Alright guys, in the beginning of World War II, the U.S. controlled an island in the Philippines known as Corregidor Island. The island was a major focal point for the naval defense from Manila Bay and its capital. Unfortunately, on May 6, 1942, after many battles, the island fell to the Japanese. U.S. survivors were taken as POWs and were shipped to war camps. Of these men was Arthur Alexander Bomi, my grandfather. He was taken to a war camp in Manchuria, and in 3 years of his imprisonment, he was faced with horrors no man should ever face. Whether it was torture or the fact of seeing all your known friends die in front of you, this indeed was a time that will haunt him for the rest of his life. He would not only carry with him the scars on his skin, but the scars in his mind. What my grandpa developed, and as many people in war develop, is PTSD, or post-traumatic stress disorder. What PTSD is, but what is PTSD? Today I'll be sharing with you the causes, the symptoms, and the treatment for PTSD. First and foremost, PTSD is an emotional illness that usually develops as a result of a terribly frightening, life-threatening, or highly unsafe experience. In most cases, PTSD is linked with battle-scarred soldiers, such as my grandpa, but PTSD can happen to anyone. It usually happens from overwhelming life experiences. Some of the examples are, some of the examples are war, natural disasters, kidnapping, sexual or physical abuse, medical procedures, violent assaults. There's so many, but yeah. All right. Here's some statistics. 7 to 8% of people in the United States will likely develop PTSD, and 10 to 30% of them will be combat veterans or rape victims. Somewhat higher rates of disorders happen in African Americans, Hispanics, and Native Americans. Now for the symptoms. The symptoms of PTSD usually starts within 3 months of the event, but in some cases PTSD symptoms may not occur until years after the event. It's common to have bad dreams or to have a hard time forgetting something and to feel worried and fearful, but usually those symptoms are short-lived and lift. PTSD doesn't lift and actually gets worse. The symptoms are grouped into 3 major categories: intrusive memories, avoidance and numbing, and increased anxiety. All right. Symptoms. The first is symptoms of intrusive memories. Flashbacks or reliving the traumatic event for minutes or even days at a time. Upsetting dreams about the traumatic event as well. My grandpa, he experienced night terrors for weeks straight, and the biggest problem he had is that he lived with things that remind him of his POW time. For instance, the removal of his fingernails. He wore gloves all the time because every time he'd see his fingernails, obviously would bring them back. And his tattoos, his naval tattoos, he tried scraping off during his imprisonment because he hated seeing them. So he always wore bandages around his arms. All right, symptoms of avoidance and numbing. Symptoms of avoidance and numbing. Trying to avoid thinking or talking about the traumatic event. Feeling emotionally numb. Avoiding activities you had once enjoyed. Hopelessness of the future. Memory problems. Trouble concentrating. And difficulty maintaining close relationships. Now for the symptoms of anxiety and increased emotional arousal. Not that I'm kind of emotional arousal, you're probably thinking. But irritability or anger, overwhelming guilt or shame, self-destructive behavior, such as drinking too, drinking too much, and drugs. Trouble sleeping, being easily startled or frightened, hearing or seeing things that aren't there. Symptoms for PTSD can come and go. They can be brought back by experiences that remind them of the traumatic event. For instance, kids playing with toy guns can make one relive a moment in the war. That was a big thing that happened to my grandpa. He saw kids playing in the park with guns and it totally made him go crazy. Or maybe a color of a man's suit that can remind you of the guy that sexually assaulted you. Ladies. Okay. Now for the treatment. Today's treatment is not hard to come by. Not hard to come by, but getting oneself or a loved one to see treatment can be really hard. PTSD sufferers will do almost anything to not relive the moment or the certain event, but unfortunately therapy has to go into that. To get one to go, you must show the destructive and negative effects of PTSD on their lives and yours. There are two major types of therapy used by to help people suffering from PTSD. The first is cognitive therapy. With cognitive therapy, therapists try to help how change and how they think are the way to help them understand with their trauma. This therapy is usually used for people who blame themselves. My grandpa blamed himself his whole life for being a POW, even though he had no control over him. It's just something that happened. Exposure therapy is a different kind of therapy. With exposure therapy, the major motive is to expose the trauma to the, well, I don't want to say victim, but to the patient, to help cope and be less fearful of that trauma. To almost come in terms with the trauma. So like people getting scared of spiders, they introduce spiders to help them, I don't know, say live with the spiders. So kind of like living with your nightmares. And all it's the best to deal with PTSD sooner than later because the trauma is still fresh in the mind. Also, after too long, trauma can be part of one's life, and to change something after that long can be truly difficult. In conclusion, PTSD is a truly destructive and mental illness that can ruin anyone's life. Sometimes we have no control of what happens to us. Who knows, you might suffer PTSD from a future event. The key thing is to react and seek help. My grandpa suffered from PTSD his whole life after the war. I believe it was the biggest factor in his death, and I know it affected my family and his siblings their whole lives. Anything can happen. The real question is, how will you react? Thank you very much, guys.
So Stephanie, what did you think?
I thought it was good and really well developed. It was well sequenced. I like how he explained everything and the background story on his grandpa, and the visuals were really good because they went along with what he was saying.
Okay. Yeah, I think that the use of your grandfather's experience for the attention device was good, and when you came back to it in a few places in the speech, that adds a personal element and interest to it. A couple of places I think we could use a little detail. You make a mention, for instance, that he had an episode or some kind of response to kids playing in the park, and I don't know exactly what happened. You say he went crazy. What did he do? How did he act? What was the problem? How was he incapacitated? We could use some description of those sorts of things. You talk about triggers, and I thought that the triggers were pretty clear. The actions and behaviors, I think, and the way it affects people needs to be developed a little bit more. You did a good job identifying what the subject was and how you were going to develop it. It's topical in nature when it's being organized, and you did an okay job signposting as you went through the points. It was maybe a little mechanical, but it was very clear, so that part's good. There's not any source citation for some of the definitions that you have, some of the statistics that you present. Obviously, on your personal experience, we're not looking for a source citation, but when you talk about the therapies or explain what all the symptoms are, or some of the things that might trigger this, I know that information comes from someplace, and you ought to be giving that authority in the presentation, and you're not doing that. The visuals, look, there are a couple of things about the visuals that worked really well. You integrated them into the speech well. You clearly planned on, I want people to be looking at this, I don't want them looking at this, so I thought that was good. I did have a little bit of a problem because most of the visuals consisted of lists, and some of the lists are kind of long. You zip through them, and then we move on to something, and that doesn't help that much. It's really not going to help our recall very much. So you have to keep things relatively simple on the visuals there. I don't know if there's the lists are not automatically bad, but since, well, yeah, I think I've used this line before.